Hello, everyone. My name is Krista Natoli. I'm the Executive Director for CTeL, and welcome to our webinar for today. Our webinar is titled Fraud, Abuse, AI, Pitfalls and Safeguards in Artificial Intelligence. We have the privilege of having Senior Associate Natalie Lorenz with us. She is also part of our legal resource team, and she has a great deal of experience in telehealth, policy, AI, and I know that she's going to be able to really be here to answer a lot of our questions. A little bit about Natalie. I've known her for years, but every time I read her bio, I feel like she's more accomplished each time. Natalie received her JD from Georgetown University Law Center in 2019. She interned for the DC Department of Health, Office of General Counsel, and served as an attorney for the Georgetown Health Justice Alliance Law Clinic. She's also was a research assistant for the O'Neill Institute for the National and Global Law Health at Georgetown Law. And additionally, Natalie served as symposium editor at the Georgetown Food and Drug Law Journal, as well as vice president of Georgetown Health Law Society. So Natalie, I know that we have many people that are interested in getting a better understanding of AI and fraud and abuse and how to prevent those pitfalls. I'm going to hand it over to you.
Great. Thanks so much, Krista. I'm going to get started with industry landscape. So we've gotten, just to frame kind of what I do, I'm mainly a fraud and abuse attorney, and I work with healthcare companies and hospitals to stay compliant within that space. And lately, we've been getting a lot of questions from hospitals asking us to review their contracts with AI vendors. Everyone wants to start using this technology across their healthcare systems. So we've seen that increase lately. I also saw a recent survey from the American Medical Association that says 2 out of 3 physicians are using AI in their practice today. From a federal perspective, we had, during the Biden administration, the previous Deputy Attorney General, Lisa Monaco, warned that the DOJ was going to seek stiffer sentences for offenses made significantly more dangerous by the misuse of AI. And we also had Biden saying that there needed to be safeguards and standards established for the use of artificial intelligence in high-risk industries. And healthcare was specifically called out as a high-risk industry. Now we have the Trump administration, who has issued an executive order, and it's titled Removing Barriers to American Leadership in Artificial Intelligence. And that executive order actually revoked the Biden era executive order establishing those safeguards and standards around AI. We also have a request for information that most of you probably saw. The responses were due last week. It was called Development of an Artificial Intelligence Action Plan. And that action plan sought out to define priority policy actions. And you can see that the Trump administration's main focus is actually removing requirements around private sector AI innovation. So we kind of have that juxtaposition from the previous administration. That doesn't mean AI is not going to be regulated. We have Congress and we also have states. Colorado has passed a law applying to AI in high-risk industries. And again, healthcare is a high-risk industry that has been identified. And Virginia, I believe there is a law on the governor's desk for signature. He has until next week to sign. And so we're anticipating that those will be the first of many laws passed in states around AI. As I am a fraud and abuse attorney, I wanted to get into the federal fraud and abuse laws that could apply to artificial intelligence. And I'll keep it high level as to not go into too many details. But first, there's the anti-kickback statute, and that simply prohibits paying or receiving anything of value to induce the referral of patients for items or services that are reimbursed under federal healthcare programs. And the statute has been interpreted broadly, and it covers any arrangement where one purpose of the remuneration, which is just that anything of value, was to obtain money for the referral of services or to induce further referrals. In other words, there may be valid reasons that healthcare companies or these vendors or hospitals are entering into contracts. But if one purpose is to pay for referrals for services, the agreement is a violation of the anti-kickback statute. There are criminal as well as civil penalties for the anti-kickback statute, and I list those out here. The anti-kickback statute also contains several exceptions and safe harbors, and one that you'll want to be paying attention to is the personal services and management safe harbor, and that allows arrangements that are set out in writing through a contract, have a term of a year or greater, do not include compensation that is based on the volume or value of referrals, and set out those compensation terms beforehand, so it's not open-ended. The next law that could apply to relationships with AI vendors is the Civil False Claims Act. So under that law, it's illegal to submit claims for payment to government programs such as Medicare and Medicaid that you know or should know are false or fraudulent. Under this law, a party can be liable even if there's no specific intent to submit a false claim. So even if the person doesn't realize it's a false claim, if they should have known, if there's deliberate ignorance to the fact that the claim may be false, that is a violation of the False Claims Act. As with the anti-kickback statute, there are criminal as well as civil penalties. The last law that I wanted to talk about is the beneficiary inducement statute, and that prohibits offering anything of value, so an inducement, to a Medicare or Medicaid beneficiary that is likely to cause the beneficiary to receive items from a particular provider, practitioner, or supplier. So one example that we see a lot is a healthcare provider routinely waiving payments for Medicare co-payments. And they can do that under the statute as long as several requirements are met. Likewise, the provider can also not give gift cards to patients to induce them to come to that provider. I wanted to mention this law because we've seen healthcare systems offering AI products to patients, and that could be seen as an inducement. Next, I wanted to get into government enforcement. And as this is an emerging area of law, there is not a lot of government enforcement so far around the fraud and abuse within artificial intelligence. But there are a couple of cases I wanted to mention, and one in particular that is kind of being seen as a test case for artificial intelligence. And we think this is where enforcement is going to be focused in the future. And that is the Practice Infusion case. So in that case, the government alleged that Practice Infusion solicited kickbacks from pharmaceutical companies in exchange for implementing these clinical decision support alerts in its EHR software. And those alerts were designed to increase prescriptions for opioid products. Specifically, what Practice Infusion did is they asked for sponsorship payments from pharmaceutical companies and allowed those companies to influence the development of alerts. So they permitted the companies to design the alert that physicians would see in the EHR software. They selected the guidelines used to develop the alerts. They set the criteria that would determine when a healthcare provider received the alert. And in some cases, they even drafted the language used in the alert itself. And in discussion with the pharmaceutical companies, Practice Infusion touted the anticipated financial benefit that these companies would see. They said, you're going to see so many increased sales from pharmaceutical products that's going to result from these alerts because physicians are going to see the alerts and then be motivated to prescribe your products. And in fact, that did happen for 5 years. From 2014 to 2019, healthcare providers used this EHR software unknowingly, and that these alerts were created by pharmaceutical companies. And they wrote numerous prescriptions after receiving those alerts. So there was a direct tie to the alert. Because of this, Practice Infusion executed what's called a deferred prosecution agreement, which basically they agreed to pay a lot of money. They paid $26 million in criminal fines, and they also paid almost $120 million in civil fines. And again, those allegations were that they accepted kickbacks. So that's the anti-kickback statute from pharmaceutical companies, and also under the False Claims Act, caused providers to submit false claims and misrepresented the capabilities of the EHR software. We believe that this case demonstrates how the government could look at AI vendors who use algorithms to steer clinical decision making. So that's something to be wary of, both on the AI vendor side and the healthcare provider side. Another case I wanted to talk about is United Healthcare, and I have the name of the case down there, Estate of Gene Loken versus United Health Group. And this case is ongoing. Plaintiffs filed a class action complaint alleging that United's reliance on artificial intelligence, specifically their product is called NH Predict, to deny coverage for rehabilitation care after hospitalization for Medicare Advantage plans, constituted a breach of contract and something called a breach of implied covenant of good faith and fair dealing. And the complaint basically alleges that NH Predict was used to compare a patient's diagnosis and demographic to similar patients to predict what kind of care the patient would need. And that is the only type of care that that patient was approved for. However, the model didn't follow Medicare coverage requirements, and plaintiffs who brought this case alleged that it actually overrode the treating physician's determination of how much care was necessary, and it ended up having a 90% error rate is what they're alleging. Lastly, I wanted to get into best practices. Like I stated previously, there has not been a lot of enforcement in this area, but that doesn't mean that there will not be. And so we have some best practices for healthcare providers when they're looking to use AI and enter into those arrangements with AI vendors. First, look at vendor compensation and how you are paying for that AI product. Is it set in advance? Is it related to the volume of values of referrals that AI tools generate? There, I want you to look for, is there a percentage of revenue involved? If so, that's not going to meet the exception, the personal services exception, which I mentioned earlier, and I've also included the reference to there. I also want you to consider whether there is access to AI services that is being provided to patients, because that could raise beneficiary inducement issues. The last thing that should be considered is whether the platform is steering clinical decision-making in a way that increases profits or referrals. That could be an issue under the anti-kickback statute. It could also be an issue under the False Claims Act if the AI is creating or involved in decision-making and it is not correct, and then the provider files a claim that is in fact false because it did not have the correct medical necessity, let's say, for example. So that's something to be wary of, and I think is the most important piece out of these takeaways. For AI vendors, it is important to consider how the AI is being used for diagnostic decisions, and can this result in false claims being made? Not only would the healthcare provider be liable, as I mentioned in the previous slide, but under the False Claims Act, if one causes a false claim to be made, as an AI vendor would in this case, they can be liable. So that's something to be wary of. Also, having a extensive governance policy and looking at what data is being defined as the input for the generative AI product is important, and how it's driving clinical decisions. And so that goes back to the practice fusion case. As with healthcare providers, you would want to consider whether access to free AI software or services raises kickback or beneficiary inducement issues. Lastly, the compensation for the AI product should be fair market value and should not take into account the volume or values of referrals. And I feel like a broken record with that one, but it really is so important. And that's probably the most important takeaway here for AI vendors. And with that, that is the end of the presentation. Just as a disclaimer, the information presented is not legal advice. I'm not your attorney. It shouldn't be acted on as such and is subject to change without notice because this is a rapidly changing industry. And I have my email here for any further questions. It's natalie.lorenz@powerslaw.com. And with that, if anyone has any questions, if we want to open it up to discussion.
Yes, absolutely. Natalie, what a fantastic presentation. I learned so much.
Thank you.
This area is so rapidly changing, and as you may know, CTeL had an event last week on March 12th. It was a digital health AI showcase, and we had a lot of questions about, what if AI is used as simply a tool? Like, for example, we had some models there that were looking for diabetic retinopathy. We had other models that were looking for potential of stroke. What happens in those situations where it's used as a tool? Um, is there any concern that some of the concerns that you put up with your presentation could apply? Or is it simply if AI is being used as the sole way to diagnose?
That's a great question. I think that is something that's going to be litigated, honestly, or regulated, because that line hasn't been drawn yet. But I think if we look to other examples, if it's influencing clinical decision making, as I believe it could implicate the False Claims Act because you still would have that, are you causing a false claims to be submitted? And if the answer is yes, there, based on the tool, it could be implicated.
That's so interesting because I've been in telehealth for 16 years, and I'd say the last 7 or 8 years, AI has been used a lot by multiple health systems and hospitals. Was it just not addressed before, or did we just not see? Yeah, well,
Yeah, I think we have been waiting for the federal government it's like with privacy law. We were waiting for the federal government to come up with standards,
yeah.
and it did not do so with respect to artificial intelligence. And now we're going to see, as what happened with privacy law, states coming out with standards. So I think that is where we're going to look next with defining these safeguards.
As you probably know, CTeL has an AI Blue Ribbon Collaborative, and the goal of that AI Blue Ribbon Collaborative is to be a source of agnostic research information for the community on AI. What would the number one policy or research item do you think that the Blue Ribbon Collaborative should prioritize?
Ooh, that is tough.
Okay.
It's tough because from my perspective, definitely the fraud and abuse area I think is important, but there's also so many other things that apply to AI. How does HIPAA apply? How does consumer privacy apply? There's a lot of areas that you can go into with artificial intelligence.
Well, thank you so much, Natalie, for a fantastic presentation.
Of course.
Do we have any questions from the audience? We see almost all new faces here today. We have one question. Yeah, can we have the slides of the presentation, please? Yes, absolutely. And what organization are you with? I think you're on mute, my friend, but any other questions?
Queen Mary University. Hi.
Hi, nice to meet you. Well, thank you so much for attending this presentation. For all of those that are new to CTeL, if you're interested in more presentations like this, please visit our website at ctel.org. There's a calendar of events. There's also a section under webinars where you could access some of our old recordings. And if you are interested in getting in touch with Natalie Lorenz, Senior Associate, she has provided her contact information at the bottom of the slide. And you could also reach out to CTeL at info@ctel.org, and we'll be happy to put you in touch with her. Thank you, Natalie.
Thank you.